Okay, this is 82 years old male with end-renal failure due to diabetes mellitus. He already on hemodialysis via fistula. On his record, you can see ischemic heart disease, his post-cabbage, and obesity that you cannot see because we make pictures of partial body. Okay, we did on him basilic vein transposition in June 2019, and up to now, fistula was working okay. This is the fistula, basilic vein transposition fistula. You can appreciate the emptying of the puncture sites when elevating his arm. This is very good for the fistula. That's meaning there is no swing zone stenosis, there is no central vein stenosis, and the report from the dialysis units, the quality is quite good, and no specific problem during dialysis. Okay, you can see that his forearm is good, it's warm, and the color is good, and also we can feel a pulse in the radial artery, which is relatively weak. Okay, so let's go now do the ultrasound. The patient is holding his arm that way. We need a lot of gel for it. We start again with the black and white, the grayscale imaging. You can see again the beautiful picture of this machine. This is a transport basilic vein, and this is the suture line. You can see the dots of the suture, and this is the brachial artery. So nice stenosis. We'll follow it with of course, we need to fix the velocity here. Okay, now we can see the basilic vein and brachial artery. Basilic vein, transpose basilic vein, brachial artery. Okay, anastomosis looks good. No need to measure flow here. We'll measure the flow in the brachial artery. And this is the basilic vein now. We'll follow the basilic vein. We are reaching now the arterial site. As you can see, sometimes you can see this kind of small clots. It's very difficult to know what's the origin of that. Maybe it's a part of a valve or something like that, but it is not significant. No need to do anything about that. There's some kind of stenosis near the puncture site here that doesn't look very significant. Okay, this area here, and then we go to the arterial sites. It looks okay, quite wide with high flow. You can see that the flow on transverse view is once it's red, and once it's half of it is blue and half of it is red, and this is due to the spiral flow in the fistula. Usually this is common in all patients. We go up again to the venous puncture site. Usually the turbulence is slower in the venous site, as you have seen before that. We can increase the gain. And this is the venous site. Okay, and now we go up with the longitudinal view. See, we are reaching the swing zone where the vein, superficialized vein, is going deeper to its origin, to the axillary vein. You can see here there's no stenosis here. We call it the swing zone. And this is a point that's very often we may have a stenotic lesion at this area due to the turbulence that is in this area. You can see this is here the transposed basilic vein going back to its origin, or to the axillary vein. with no significant stenosis here. It means the clinical examination was a good fistula, and also the ultrasound examination, we didn't find any significant stenosis. So now we measure the flow. He's quite a big guy. So you can see that the artery is relatively deep, but we can measure easily the flow here. We zoom in, make it more accurate, and measure the flow. The flow is about 1 liter per minute. That's a nice flow. We can repeat this measurement again. We'll adjust the markers to 3 heart cycles, and here we can see that the flow is a little bit lower, but I think the measurement is not accurate than the other one. So practically the flow is about 800 milliliter to 1000 milliliter, which is very good. Now we shall examine the blood flow in the radial and ulnar artery to see if there's any signs for still, because they have all the risk factors for that. Okay. We already palpated the radial artery, but we can see that the flow is quite good in the radial artery. Okay, so this is the radial artery. Let's see what about the ulnar artery. You can see that the ulnar artery is quite calcified here. All the white areas here on the wall of the artery, the white one are calcification inside, but the flow in the ulnar artery is quite good. It looks good in the duplex. Okay, so the risk is very low in this patient for still, and the fistula working okay. So we'll examine him again within 6 months from now. And we are done here.